Hi there. I know you've just heard that you or your child has been diagnosed with a blood clot, also called a thrombus. And that's a lot to take in. First off, I want you to know that blood clots are actually very rare in children, but we are seeing more of them in hospitalized kids, especially newborns and teenagers. Now, I'm sure you have a lot of questions like, what exactly is a blood clot? And what are the signs and symptoms of a blood clot? So let's walk through this together. Blood clots form when blood thickens and forms a sticky plug inside a blood vessel. The term blood clot usually means deep vein thrombosis, which is referred to as DVT when they are in the arms and legs, and they occasionally can be in the brain and abdomen, and pulmonary embolism, referred to as PE, when they are in the lungs. In children, blood clots can happen for several reasons, including a trauma, surgery, taking certain medicines, having a deep and central IV line, inflammation, and not moving much. Most blood clots in newborns happen in the hospital when central or deep IV lines are used for care. If this is the case, you might notice swelling, pain, or redness around the spot where the clot is forming. Most DVT blood clots are found on an ultrasound test. In teenagers, blood clots can also happen after having surgery, taking certain medications, or a trauma.
Recently, I hurt my knee playing soccer. At first, it didn't seem too bad. I just needed a knee brace and thought I'd be fine. But then, things got weird. A few days later, I started having this really bad pain in my calf. I thought it was just from the knee injury, so I took some pain medication. But it didn't help at all. I also noticed some swelling in my leg and had a hard time walking. Then a few days later, my chest started hurting and I couldn't breathe right. I knew something was wrong, so my parents called 911, and I ended up in the emergency department. When I got to the hospital, they did a bunch of tests: blood work, an ultrasound of my leg, and a CT scan of my lungs. My team found out I had a DVT in my leg and that the clot traveled to my lungs, which they called a PE. I know that sounds scary, right? But my team broke it all down for me and told me that they could treat it and I would get better. I had to stay in the hospital overnight, where they started me on a blood-thinning medicine called enoxaparin, or low molecular weight heparin. It keeps the clot from getting bigger or traveling anywhere in my body. I was a little nervous, but my team reassured me that I'd be okay. A nurse gave me the enoxaparin shot. The nurse explained how to give the shot step by step so we could do it at home.
First, you need to choose where you will give the shot. The options are the back of your arms, on your stomach about 1 to 2 inches around your belly button or your outer thighs. It's a good idea to rotate between these areas. This medicine has to be given into fatty tissue under your skin, which is called subcutaneous tissue. Next, you need to clean the area. Wipe the skin with alcohol for 10 seconds in a circular motion and let dry for 10 seconds. Don't wave or blow on the area, just let it air dry. Then pinch the skin. Hold the syringe like a pen and inject it anywhere from 45 to a 90-degree angle. In my experience, giving it at 90 degrees doesn't cause as much bruising. Once the needle is in your skin, you want to push the plunger slow and steady until it hits the bottom and you can't go any further. At this point, hold the plunger down for 3 seconds before letting go. This will also help with bruising. Then take the needle straight out, holding moderate pressure for 2 minutes. Do not rub the area where you gave the shot. Never recap the needle. Dispose of the needle into a sharps container, or if at home, into an empty laundry detergent bottle, and you're done.
It wasn't as bad as I thought it would be, and I had to have a blood test to make sure I was taking the right dose. Before I went home, my parents had to give me a practice shot just to make sure we knew what we were doing, and because I'll need to keep taking this medicine at home. While I went home on the enoxaparin shots, my team told me that they will most likely transition me to a pill soon, which is kind of a relief.
Now, all of this can be pretty overwhelming at first, but after we go through all the teaching with you, you should feel more confident and relaxed.